Hi, everybody. Welcome to Experts Dig In with Doggies for Dementia. This is Carmen DeValis, and I'm the founder of Doggies for Dementia. And I have a wonderful guest today. We are going to talk about Lewy body disease, all kinds of stuff with Lewy body disease. I've got Sarah Hyde-Williams here today, who is a dementia consultant and just so knowledgeable. So we're probably going to be in two parts today, which is awesome. Welcome, Sarah.
Oh, thank you for having me.
Yeah, so, okay, dementia consultant. Can you just tell us what that means?
In essence, I meet with families and I guide them through the process of finding care for their loved one, no matter what that may look like, depending on their goals, what they would like to achieve, and what their loved one would like for end of life.
That's super helpful. And is this a relatively new kind of endeavor in general for families, recognizing that families have needs? It's not all just the medical, like the doctors or the nurse practitioners, things doing these guiding, because it wasn't good enough, I will tell you, you know.
It's quite interesting. A lot of people come to me when they're looking for a dementia care community, or I work with a lot of, quite a few neurology clinics that will send patients my way when the caregiver is having extreme burnout. Yeah. They're way overwhelmed, or whether or not for their own safety, we need to look at a dementia care community, and then they'll ask me to come in, and instead of 12 minutes in the doctor's office, they'll ask me to go and meet with the family for sometimes 2 and 3 hours to really get the full dynamic of what we're looking at, and to guide them in that process.
Yeah, that's huge. That's huge. And that's wonderful, because truly as a, as a former nurse practitioner, I only had so much time, and there's so much, and nor did I know all that was out there. Honestly, there was no way I could keep up with everything. So yeah, greatly appreciate that. Wonderful, wonderful. All right, so we're going to talk about Lewy body disease today. I'm sorry, I cut you off. What was that?
Good, my honor. I love Lewy body dementia, dementia with Lewy bodies, Parkinson's disease dementia, and it's become a real passion for me, and so I'll speak about it all day long.
So, I've never asked you this question. Why do you in particular have this interest? I think it's wonderful. I don't know that most of us have a story why we're interested in a particular. Why Lewy body disease for you?
We all have a why, don't we? I have been in long-term care, assisted living, dementia care, home health, hospice, that entire continuum for almost 20 years. What I began seeing in our dementia care communities is that Lewy body, we know, is one of the most challenging of all dementias. There's a term that's thrown out there an awful lot of time: behaviors. And so few of us fully understand what those behaviors, or what I like to call expressions, really mean, and how does that affect how we give good quality, respectful, dignified care. And so I saw a lot of our memory care communities, God love them, they're doing a fantastic job, did not understand Lewy body. So therefore, they would be overwhelmed, not quite know what to do. When that person went out to the hospital, they were saying, we can no longer meet your needs, and for lack of a better term, refuse them back.
Oh boy.
That's a shame. And how can I do my part in educating families, in educating frontline staff, even leadership in these memory care communities, and understanding what that looks like and how we can give better care.
Yeah, and certainly, our mission is to educate the public, and for caregivers and care partners to be aware too. So that's so important. And I would think it would even just blow most of our minds to know that people were living in a particular long-term care community, and you know, obviously we're having some problems or what have you, have some kind of an illness, then on top of that, get sent to the hospital, but then they're told they can't come back.
Yeah.
You know, that's just
It's
mind-boggling.
devastating for families.
Yeah, because then it's the families, it falls on their lap then to say, where are we going to go now, right?
Yeah.
Oh boy. Yeah, see, I think that's just, if I could, I would have my steam coming out of my ears right now, you know,
And that's where I was 3 years ago when I came on board as the Central Texas educator for the Lewy Body Dementia Association. So through support groups, education, whatever I can do to get that word out. I educate a lot of physicians as well. So
I bet. Yeah, because I think in general, you know, Alzheimer's is the most common form of dementia. And Lewy body is another type of dementia, just like Alzheimer's is. But Alzheimer's, of course, we hear more about and we see more of. But Lewy body is not uncommon either as a type of dementia, right?
we do. Alzheimer's accounts for about 50 to 60% of all neurodegenerative progressive dementias. Lewy body, as much as it is misunderstood and misdiagnosed, is second in that quote pecking order. About 15% of all dementias diagnosed end up being Lewy body type.
Yeah. And so neurodegenerative, meaning there's a slow decline, usually it's slow, decline of their ability to think clearly, the cognitive, as well as mobility. And then it just continually gets worse as time goes on. Yes. And
all of that.
Yeah. And so hard and no cure. And so families are looking, saying, okay, this is tough and we have a long road. What are we going to do? So thank goodness you're there to help with a lot of this and to help make sense. And especially with regard to Lewy body, because I know a lot of even healthcare providers, it's somewhat of a mystery and it's challenging. And
it is.
Knowing what to do. And so we'll just put that out there. It can be really challenging, but we're learning more and more. So thank you for that. All right, so let's talk about then, so once you're talking about Lewy body disease, what would you think are the top things that we should all know about Lewy body disease? We know, you already said neurodegenerative.
Absolutely. It is misdiagnosed oftentimes either as the cognitive portion of being Alzheimer's or the motor dysfunction in being Parkinson's.
Right.
So knowing that, and where some of our folks fall through the cracks is they go to a support group, they're doing all things right, but they go to an Alzheimer's support group and they're sitting there thinking, my loved one is not necessarily like that. And so it doesn't quite fit. It's when they get into a Lewy body dementia support group is when they go, aha, that's it. So some of the things that we oftentimes see with Lewy body dementia are two different things. We either see the motor dysfunction, which is typically diagnosed as Parkinson's. So the small movements, the shuffling gait, the small handwriting, that's an interesting sign and symptom.
Yes.
The oftentimes expressionless face, sometimes it's referred to as stone face, the protruding chin.
So with I'm going to go just back to the handwriting. You said the small handwriting, so people write really tiny. Yes.
Very much so. When I do a consultation with a family, I'll oftentimes ask about their handwriting, and it's an interesting thing to see how families go, I have no idea how that might fit within this, but I'll begin explaining a lot of this, and they'll go, oh yeah. Loss of smell. Loss of smell can be one of those signs and symptoms that shows up 15, 20 years before an actual diagnosis. So I always ask about their smell.
Wow. So how many, 15 to 20 years, you said? Consistently?
Before an actual diagnosis, yeah.
Wow. So consistently not being able to be able to smell things very well, or you said
or
smell and
taste.
or taste. Wow.
Yeah,
So probably then weight loss too, because you're not smelling food and tasting it.
nothing sounds good. Yeah,
Yeah.
food is not satisfying. Yeah.
Mm-hmm.
So we've
Mm-hmm.
got the motor dysfunction on one side, and then we've got the non-motor symptoms on the other, which there's usually four categories of those. Big long word, dysautonomia, which just means that there's a portion of the nervous system that does those things automatically in our body. Regulate our temperature, our blood pressure, beat our heart, breath at certain points of time. So that dysregulates in the body, and so we see a lot of low blood pressure. We see a lot of falls. They'll hop up
Mm.
out of their chair way too quickly, blank out, and fall to
Mm-hmm.
the ground. So we see a
Yeah.
lot of falls
Yeah, because the blood
in
doesn't get to the brain in time, right? The blood pressure's too
yes,
low. Yeah, so
yeah.
this is why there can be misdiagnoses too for a while until it becomes clear, right?
Very much so. And we start putting all those things together, and we
Mm-hmm.
begin looking a little bit deeper. A second diagnostic criteria for those non-motor symptoms is sleep pattern disorder, REM sleep disorder, or sometimes what's called dream enactment disorder. So typically through the portion of sleep when our body is regenerating and forming those short-term memories in that memory bank, our body automatically shuts off movement. And so what we see in this disorder is that it doesn't. And so what our dreams have us doing, if we're running from a lion out in the Serengeti, our body will actually run. And so we'll see, I'll ask families oftentimes, do you still sleep with your partner?
Mm-hmm.
Are the sheets just completely ripped off the bed in the morning? Have you ever been hit or kicked in the middle of the night?
Mm-hmm.
That is a big portion of this as well. Insomnia, restless leg syndrome, we see that as well.
Yeah, I used to hear that a lot from
Yep.
spouses. They're just like, it's brutal at night. I can't stand it.
Yes.
Mm-hmm.
Oftentimes by the time they get to me, they're sleeping in either separate beds or separate bedrooms. Yeah.
Mm-hmm. So that's another puzzle piece. Yeah.
Some of what we also see is mood disturbance, lots of depression, anxiety, apathy. It's just, it really messes with our will to get up and do. And that's hard for a lot of families to understand.
Mm-hmm. Yeah, and sometimes that happens before even the symptoms are clearly obvious of what's going on. In fact, most of these do.
Very much.
It's like a puzzle, actual puzzle pieces you're putting together before like, oh.
It is. Yeah.
Mm-hmm. Yeah, because there's no
And
blood test for this, right? We don't have great tests
there is
for,
not.
yeah, it's
There
putting
is
to,
not, there's not a CAT scan, an MRI. There is nothing that indicate these Lewy bodies in the brain until autopsy.
mm-hmm.
And what's even interestingly enough is a lot of these dementias that we're seeing are not pure dementias. So you could indeed have Lewy body and Alzheimer's.
Yes.
You could also have the piece of Parkinson's in there all as well. So it sometimes is layering dementia upon dementia that is, it's insidious sometimes.
Correct.
To try to figure out how everything plays out.
Yeah. Yeah. And such a confusing thing for families, because even in the point of diagnoses and explaining, we say, well, it's likely that it is, X, Y, or Z. And that's because we're putting the puzzle pieces together. And they said, well, isn't there a blood test or something we can do? I'm like, that's another piece. There's just so many pieces about this that are challenging, and that's one of them. No real clear answers. And the mix, definitely the things like the longer people live, and it's a long course, which is a surprise to people, it can be 10, 15 years or more. And that,
It can be, sometimes it can be up to 20 years.
yeah,
People ask me that all the time. How long
yeah.
does my loved one have to live? There's so many different factors in this. How early in the disease process did we catch it?
Right.
How late in the process did we catch it?
Mm-hmm.
And depending on comorbidities, which is a big fancy word for how many other um, chronic health conditions do we have going on, can
Mm-hmm.
all lead as part of that too. The standard pat answer is 5 to 7 years after diagnosis.
Mm-hmm. Yeah. And of course, there's all those factors. And so if you've got one of those other illnesses that needs close supervision, such as diabetes, for instance, and in the beginning, especially before it's really well known, maybe the person isn't doing so well managing it. So the
Correct.
diabetes has been out of control for quite a while, and that is a wear and tear on the body too, and lots of factors involved. But yeah, one of the common myths I would hear is that people are diagnosed and then they go into a nursing home and shortly after they die. And there's just so much wrong with that, that myth all the way around, right? I'm like, did you realize it's a very long course and most aren't in nursing homes? And
Yes.
what?
That is one of the things I love to do with families. I love to get into that consultation with families earlier in the process.
Mm-hmm.
Therefore, we can know what an individual person's wants and wishes are. It's kind of like an advanced directive for care.
Right.
We can build that plan A. We can build that plan B, and we can really be honoring of what that person wants for the quality of life for as long as they have. So it's also a peace of mind for the caregiver, as the care partner as well, knowing that we've got a plan. I don't have to get in an emergency situation, then figure out what I'm going to do.
Right. And I think for a lot, it's a very difficult conversation to talk about end of life care or the process of care when they're not going to be able to make decisions. But I think that mindset, we're doing it to honor them, to honor their wishes, that it's a respectful thing, I think it really changes the whole dynamics and is really, really important, because I caught what you said early on about sometimes you're called in a crisis time when people are thinking this is not safe anymore. We need to find long-term care placement of some kind. I don't know what that is, of course, they're not sure, right? So when you're called in at that point, it's a crisis, and it's not the best time for information.
Yeah, I do a lot of crisis work, and whether or not they're currently in a hospital, a skilled nursing facility, and the social worker has come to them in the morning and saying, we're discharging in the afternoon. It's not safe for them to go home. Where are you going? Those are crisis situations, but
that's
for the most part, I love working with the neurology clinics I do currently work with, and providing that way ahead of time, what's our plan? So they don't get in those crisis situations.
That's wonderful. And I think if there's any takeaways from this listen, is be prepared well ahead of time. Get your information, know what you need to know, and get those resources in place, and that people who know you and that you trust, that you can have along the way, because you need that. It's a marathon, and it's not a single person road either.
Absolutely.
It's a group.
One thing to really know, and I would like to highlight, is that accurate diagnosis for Lewy body dementia is critical. Oftentimes I meet with families and I'll say, what type of dementia do they have? I don't know. It doesn't really matter, does it? And I say it does. An early diagnosis of Lewy body dementia means that oftentimes with this disease process, we see medication interactions.
Oh, yes.
They're very sensitive to medications, and therefore, if we can not go with certain classes of drugs that might cause difficulty for them, life-altering signs and symptoms that we can do better for the individual.
Yeah.
Certain antipsychotics are used oftentimes for these types of dementias. And so there are certain ones that Lewy body dementia does not mix well with.
No.
Some of your more traditional antipsychotics we need to stay away from.
Yeah, and that's it. It's easy to happen because what they're being seen for are certain symptoms that seem to go along with Alzheimer's or something along that, although we're really careful with those anyway. But then as the symptoms, we start to put the puzzle pieces together, right? Then it's time to stop those that could be dangerous. And so there's a lot of room for error in there. And okay, so that's super important. All these things are just so important. What else do we need to know? What else do we need to know about Lewy body disease?
Well, there is no cure. We can't fix it. We can sometimes, we can't even necessarily slow it down, but what we can is treat signs and symptoms. We can give the best care that we possibly can. There are certain medications that are coming now that when there are hallucinations present, and that is one of the diagnostic criteria for Lewy body as well, are visual hallucinations, typically people, children, animals, that if they are horrifying in nature and it is more humane to give a medication than not, there are out on the market some medications that can help that. Mm-hmm. For the most part, we can treat signs and symptoms. We can't treat the disease process away.
Right. So some of we've talked about the physical problems. It kind of presents like almost like Parkinson's with the tremors and the shuffling, small steps with the head forward, kind of when people are walking, you know, most of us kind of walk straight up and down, but with Parkinson's is that lean forward with the head forward, the small handwriting.
Another interesting thing to think about is they have oftentimes difficulty with visuospatial concepts. So let's put this in a very simple terms. Curbs are the biggest offender. Yes. So what I absolutely love to see is on a sidewalk, when there's a drop off or a step up, that it's painted a certain color. There's an indicator that there's a change of gradient there. That's important, but for the most part, an awful lot what we see is a lack of depth perception. Yeah. So we step off curbs or we don't see the curb and fall into it. So that happens an awful lot as well.
Yeah, I've even had patients, and you mentioned depth perception, who the main presentation was there's some funny thing. So all these little puzzle pieces, right? And then like, they keep, you know, having troubles parking or bumping into the wall with the car, hitting people, you know, not other cars, you know, or what have you. So all the driving problems, and which is a whole nother topic, but that's so that the motor thing. And I wanted to say too about the visual spatial, one of the common things I saw too, when, you know, sometimes floors have dark tile, white. So as if you think of the standard checkerboard, would be a nightmare for someone with visual spatial, because those dark ones look like holes.
They look like holes. Yes, and it's frightening. When I go into senior housing communities, anywhere along the spectrum, oftentimes I'm looking at the carpet. And if we've got these big elaborate patterns and darks and lights, and it can be so incredibly confusing. And I oftentimes take note of that. I take note of a lot of things that maybe others wouldn't take note of, but it's an interesting thought process when we go through large buildings to look at the carpet.
And you would think they would have that nailed, because it's not just Lewy body disease that have that particular, you know, that depth perception or that visual spatial, where how far something is. And, you know, because people are walking and they see that dark and they want to step over it, and then we're having falls, right? because Alzheimer's, they can also have, it's the part of the brain that's affected. It depends, right? Can also have that symptom. So yeah, I would never expect to see that, but it sometimes you do. Yeah.
So you did ask me some important things to know about Lewy body, and first and foremost, you don't have to do this alone. No family should have to face these types of challenging diagnoses alone. There is a ton of education, support. If I could give a shout out to a couple of websites that I absolutely love. First and foremost, support groups are just invaluable. We have 4 here in the Central Texas area. One that actually includes those living with Lewy. We break out into 2 groups, and they have a group of their own led by a licensed therapist. Another great website is LBDA, which is the Lewy Body Dementia Association.org, is a phenomenal source of information, online support groups. And then the National Institutes of Health put out some really good materials as well. Their website is phenomenal, and they also put out a couple of pamphlets that I use in my practice when I'm educating not only care partners, but community settings and even physicians that I have at my readily disposal to hand out for education materials.
Yeah.
So there's a lot out there, and you don't have to do it alone. Reach out and ask for help.
Yeah. So thank you so much for saying that, because that support piece is huge.
Yes.
I want to say too, we will have those websites and information as part of the description here, because that's really important. And we'll make that step a little bit easier. You don't have to go and search it out, because that's important too. Yeah. Yeah. So I've learned a lot about Lewy body disease today. So thank you. And
absolutely,
it's one of those we want to talk more about, and we really want to talk about it for the care partner, the caregiver perspective for families now. So we know, what do you need to know? And we're going to do that on the next part. So thank you, Sarah, for being our guest today. Really, really appreciate it. Yeah. And I will see you soon. And thank you so much again. And we will have that information attached too. All right. Take care, guys. Thank you for watching. Bye-bye.
Okay.